We are talking about emerging technologies applied to UB, or that we can apply to UB where we are, and what forthcoming soon. Try to imagine what forthcoming soon. I have no disclosures, and where we are. Yeah, nowadays we can use ultra high definition and 3D image, ultrasonic bone knife, ultrasonic aspirator, laser in sometimes, spine and neural navigation system, augmented reality and virtual reality, and robotic navigation. This is our moment. Well, about ultra high definition image, talking about 4K and 8K. Well, the resolution of ultra high definition is the main topic. The resolution means the number of the pixel that we have in the image. In 4K, we have 4 times, and in 8K, we have 16 times more pixel than in full HD, full HD. And what we can use this about image, clarity image, deep perception, and transform these in surgical precision and reducing of iatrogenic injury risk, okay? This is the highlight. 4K and 8K boost 4 and 16 times more pixel than full HD. Deep perception, in particular in 8K, deep perception is so important. Maybe this is the most important in high definition image, because we can reduce iatrogenic and improve our accuracy targets. In this image, it's possible to see the difference between full 4K and 8K. The number of pixels in 8K is 16 times, and the clarity of the image, the deep of the image is very, very interesting. Another picture. Pay attention in the right picture. It's possible to see details. The color is so intense. The details of the dogs, the eyes, and if you compare with the green area, it's possible to see perception of deep. It's not possible in the left image. And another important about magnification. It's possible magnification in 8K with maintain all the image, the edge of the image, the color of the image. The magnification can help us, like in surgery. We can compare right and left side, full HD and 8K. It's possible to see details of the vessel, to see colors, to see the tissues, details of the tissues, and in spine surgery, too. It's possible to see some extruders that it's not possible to see in a normal standard image or in full HD image. And you can decide if this structure is a vessel, is a bond, and it's more secured your surgery. And what's happened when you merge 8K and 3D? A new image, 8D. A fantastic new image, 8D. It's expensive technology, but it's possible to use in some cases that we need improving your sharpening and deep of field. Something like this. At the right side, it's possible to see details of the tree, the edge of the mountain, the sensation of deep at the behind the mountain. Okay, and I think it's another difficult technology that we can use. Another technology that we can use, ultrasonic bone knife. Some highlights. The principle of the ultrasonic is a vibration, 33,000 per second, and elastic structures are significantly more resistant to ultrasonic. Enable us to use in contact with nerves and with other extruders. Interesting video again. Dr. Zhang using ultrasonic bone knife in a ossification of LPP. We can use to reduce the ossification, and we can see that it's possible to use around the spinal cord, like in this case, and preserve all around extruders. Another important things, we don't have bleeding when we use ultrasonic bone knife. It's possible to work with a minimal bleeding. Here is a spinal cord, and another kind of knife, a hook knife of ultrasonic bone. You can use near the spinal cord, and I think it's an interesting instrument. Ultrasonic aspirator is the same idea. The highlights about the function. You use it in tumors. Then vibration is around 23 kilohertz, 20,000 per second. The idea with ultrasonic aspirator is create a cavitation effect. A cavitation effect is a process of boiling, but not for temperature, is by pressure, by vibration. And because of this, tumors and other structures with weak intracellular bonds are easy to fragment, and we can use near delicate structures like nerves and like vessels. Nowadays we have a growing number of the papers with spinal tumor treated with endoscopic spine surgery, and maybe in this specific condition, ultrasonic aspirator can be used. Yeah, you have a systematic review and not yet meta-analysis, but with this kind of tips, a delicate tips, small diameter, it's possible to use with endoscopic surgery. Another technology is about laser. It's not so common to use. Laser is an acronym for light amplification by stimulate emission of radiation, okay? But the most important that laser beam is a powerful, monochromatic, directional and coherent beam of electromagnetic radiation. What is this? Monochromatic, one wavelength or color. Directional, that the light is emitted in a specific direction. And coherent, that wavelengths of laser are in the same phase in the space and time. Because of this, the laser is so powerful. Why wavelength is important? Because different wavelength you can use in different situations. Short wavelength is used to vaporize tissues for ablation, and longer wavelength, like red, infrared, is used to coagulate tissues. Pulse duration is important because short pulse offer high peak of power, and they use for ablation, and long pulse is provided for health, for coagulation. The main indication is disc herniation, disc vaporization using laser, but there is some interesting indication or some papers using laser for vertebral stenosis, ablation bone. FDA cleared system laser for spine, for disc decompression, laser using diode. For amyotomy, use Holmin, and facet joint ablation, use diode laser too. Maybe the most interesting for us, because it's frequently, it's a spine navigation. Spine navigation, we need to think in spine navigation like a GPS. GPS is a God's plan for spine, okay? And the main idea behind the spine navigation is a real-time anatomical location. Think spine navigation like a GPS. We have GPS trackers coupled on surgical tools, and it's possible constantly updating the position during the surgery. The essence of the navigation is to transform complex procedure into guide journey, like a car, like a travel by car using GPS. And the benefit, minimizing risk and paving the way for fast recovery of the patient. Maybe the spine navigation is the most feasible cutting-edge technology for use in endoscopic spine surgery, occupying an intermediate position between fluoroscopy, low cost, and high technology, such as augmented reality and robotic surgery. The benefits improve the accuracy of the compression and implant placement, reduce radiation exposure, because after the spine navigation is calibration, we can use during all time with not necessary to use radioscopy. This can reduce time and improve postoperative outcomes. This is a step to set up navigation. Don't worry about this. Only we have image acquisition, appropriate platform, trach system installation, calibration. Maybe this is the most important part of the use. We need excellent calibration, because the calibration transform in a real-time visualization. If the calibration is not good, the visualization make shift. Here, the sequence, the setups, and the use of spine navigation at different parts of the surgery. At the beginning of the surgery, to mark the end point, during the surgery to localize, and the compression, put cage. It's important. Here, example of surgery using spine navigation. Again, the papers, the number of the papers using spine navigation increase a lot. Some intersync papers, systematic review, but not meta-analysis. Okay? I don't know if anyone knows about the authors of these papers, Dr. Javier, Dr. Diego, and it's an interesting paper using spine navigation during fusion. The number of patients, 7 patients, and the conclusion about the intraoperative navigation and endoscopic visualization used together at the same times at accuracy and segurança and safety to live. Okay? Disadvantage, maybe a crowd, because we have so much screen and system inside the room. And another important disadvantage is about attention, because you are not looking to operative field, you are seeing to the screen, and maybe this is a problem. Okay, but we need to go, we need to improve our surgery with technology. From here, spinal navigation, to here, robotic navigation and augmented reality, both based in spinal navigation, but available with high cost. Augmented reality is very, very interesting. The idea behind the augmented reality is to superimpose virtual information onto the real world. We use during the surgery, real time, use it intraoperative time. The benefits, it's help surgeon avoid errors and improve surgical outcomes, and provide surgeon with a better view of anatomy, and apply preoperative planning in a real time. We transform a transition from virtual world to a real world, okay? Maybe AR is the most exciting and promising cutting-edge technology applied to spinal surgery, including ISUBE. The number of papers Yeah, it's increasing. Interesting papers like disruptive technology in spine surgery. The first system approved, FDA approved in 2021 for use in the spine. And nowadays we have some system with FDA approved, like XVision, Visor, and OnePoint. The price, okay, the XVision is around 108,000. The Visor don't have pricing information. And here, it's possible a video, please? A promotional video, I don't know if it's possible. It's a promotional video by XVision, a demonstrative video. Yeah, now. You use a head instrument, integrate headlights, integrate camera, and a customized headset. It's very, very interesting because you can habilitate the image in your operative field. It's a navigation that you are looking to the operative field. It's fantastic. This is one kind of augmented reality. In this case, the surgeon is using for fusion, but it's possible to use for the compression and for another pathology. We need to calibration too, the same spinal navigation, but it's very, very interesting because we can plan all surgery using AR. After calibration, we can choose your endpoint. It's not necessary X-ray. And plan your surgery. And after this, it's possible to maintain your surgery without any use of fluoroscopy. The robotic navigation is another technology. The FDA approved the robotic navigation only for minimamente invisible instrumental and spinal fusion. Experimental, there are new applications, but until now it's only adjuvant for a spinal fusion. Share similarity with spinal navigation. We need all steps to set up. The system is the same plus robotic arm, because instead you use your arm, you calibration the robotic arm to put the screw, okay? This is the main difference between you use spinal navigation with freehand and robotic arm. FDA cleared navigation system for spine, Mazor, Rosa, Excelsius, and Circ Robotic. The problem is the price, is the most expensive MIS technology. Mazor, 1.52 millions. Rosa, 1 million, 1.5 million. Excelsius, near 1 million. It's so expensive. And the future, to finalize, what forthcoming soon? Bem, I think that the mix of all this technology with AI, artificial intelligence, is the future about the technology in spine surgery. The complete integration about man, human, robot technology. And I hope so, robotic arms with fantastic precision, surgeon controlled, equipped with 8D vision and AI algorithms to a real-time decision intraoperative. AI will analyze real-time data from image and sensor, guide the robotic movements and adapting to unforeseen anatomic variation. I think it's possible in the future. Another technology is a 3D holographic visualization, surgical suites with 3D holographic visualization. Something like this, yeah. It's a suite with a holographic system with a robotic controlled by AI and the surgeon. The topic is very, very interesting. Some journals are preparing, special issues like neurospine. Publication date, March 2024, about robotic and AI in the spine. And to finalize, I make a question to Bard AI service. Bard, how will it be next step in cutting-edge spine surgery, merging robo, AI navigation, and augmented reality? And the answer, the future of the spine surgery is bright, and the integration of robotic, AI navigation, and augmented reality technology has the potential to revolutionize the way we treat back pain. These advancements will lead to more precise, personalized, and less invasive surgery, improving patients' outcome. This is an example about AI, a simple example that the interaction about something that you use in spine surgery. Thanks a lot.